month's hospital rounds. I'm Kyle Schwartz, and my guest today is Dr. Julie Lavender. Welcome to the program,
Thank
Dr.
you.
Lavender. And we're going to be talking today about urgent care, particularly the one in Louisville, Family Care Urgent Care, which is where you work. But before we go into that, let's talk a little bit about you. Where did you go to school and grow up?
I grew up in Cleveland Heights, Ohio, and I was the youngest of four, and then I moved back here in 2004 with my husband. He's a Louisville native, so now we live in Louisville and have two children, and I'm lucky enough to work where I live, so it makes it nice.
That does make it nice. Cleveland would be a hike to go back to that area to work. So where did you get your medical degree from?
I went to Wright State University in Dayton, Ohio, and then I did my family practice residency, completed that in 1999, and I've been doing urgent care ever since. So this is my 14th year doing urgent care.
Okay, have you always been at Family Care Urgent Care?
Ever since it opened. It opened in 2006 in Louisville, and prior to that, I worked at Alliance Hospital in the emergency department and also doing occupational medicine at AltWorks. But once the urgent care opened in 2006, I've been there full-time ever since.
All right, well, tell us a little bit about urgent care in Louisville. Where is it located, and what's a typical day like for you at urgent care?
It's located on Main Street in downtown Louisville. It's in a plaza with some restaurants, Grinders, Papa John's, other things. We're right in the middle of the plaza. We're open 7 days a week, 364 days a year. We're closed on Christmas, but we're open 8 a.m. to 6 p.m. Weekdays, and then we're open 9 a.m. to 2 p.m. on Saturday and Sunday and all major holidays.
All right, how many doctors are on staff there?
I'm the full-time medical director there, and then we have a part-time physician there, Dr. Maggie Lopez, and two kind of moonlighting physicians that fill in once in a while, but it's primarily either myself or Dr. Lopez that is there.
Okay. Well, I think a lot of us as lay people get confused about when to go to urgent care, when to go to emergency care. What's the difference between the two? So can you kind of clear that up for us? What
Sure.
is urgent care versus emergency room?
Sure. It's actually a great question because it can be very confusing to know where to go when you're sick or injured. First, I would start by saying it's always best to have a primary care physician and have an established relationship with that doctor. But a lot of times your own doctor is not available, and so you have a child with a fever, or you wake up and you may be very ill, or maybe you slipped and fell on the ice outside and you have an injury. If you go to the ER is really designed for major injury, major serious illness, things like heart attacks, strokes, severe abdominal pain, severe trauma, motor vehicle accidents, car accidents where there's maybe internal injury or head injury. That's where the emergency room is really designed to fully evaluate and treat you. But our forte in the urgent care is seeing people when they have minor illnesses like ear infections, head colds, sinus infections, strep throat, chest colds, bladder infections.
So bothersome but not emergency necessarily.
That's right. That's right. So if you're upright, walking, talking, not in severe pain, not severely confused, or haven't been in a recent accident outside where there's major damage, you're probably okay to come in. A lot of people don't know, too, that we can see you for your broken bones. We have full x-ray on site, digital x-ray, where the doctor on site will read your x-ray, and we will treat your broken wrist, broken ankle, dislocated finger. We'll pop it back in place just like the emergency room, but we're a lot quicker and we're certainly less expensive.
So the wait time is probably a lot less, right?
The wait time is a lot less. I kind of think of it as, if your car needs gas, and, why would you drive across town to a gas station with more expensive gas and a longer line than staying local for the same gas at a much less expensive price. It's kind of the same thing. And we will tell you, sometimes our role in at the front window is to redirect you. So if you come in and it's something we feel we cannot fully evaluate accurately, quickly, or if you need more testing in the emergency room, then we will direct you there. And sometimes we even have to call an ambulance for people to take them to the emergency department right from our office.
Okay. All right. So how many patients on average, I'm sure every day varies, but how many patients would you say is an average day?
Probably through the week. Of course, it varies by season. Right now we're in cold and flu season, so we're a lot busier right now. We probably see over 40 patients a day right now through the weekdays. Sometimes 20 or 30 on the weekend days. Weekends are busy because that's when people aren't working or in school typically. So we see 30 to 40 a day through the week, and maybe 20 to 30 on the weekends.
Wow, okay.
Yeah.
So you have some interesting news that you are located, as you said, in Louisville, but some good news coming to Alliance. Tell us about that.
Yes. Well, in addition to our urgent care in Louisville, next month Alliance Hospital is opening its first after-hours office. So it will be open primarily when your doctor's office is closed or getting ready to close. It will open at 4 p.m. and it will stay open until 9 p.m.
Oh, wow. And where will that be located?
That will be located, some people remember the old IMS or Immediate Medical Services, right on Main Street, across from Montrose.
State Street? Is that what
Oh, excuse me, yes, State
That's
Street.
right, you're thinking of Louisville, I think.
Yes.
Okay, so State Street across from Montrose. And, okay, and so it'll be open from 4 to 9. And the same services that you talked about at the family care, urgent care.
Yes, it'll have x-ray. It'll be staffed by physician assistants with myself as a medical director overseeing and many project managers who have worked long and hard to get it open from the hospital. So it's an exciting thing. I think the community of Alliance certainly will benefit from having a clinic that is open in the evening.
Right.
And even we see patients that, we close at 6 in Louisville, and there's often times where that is really a rush for people to get to our office by 6. So it gives people another choice until 9 p.m. going to Alliance and getting their care there.
Is this a trend in a lot of cities to have a place like this that's open till 9? It's not an emergency room, it's an urgent care?
I believe so. Many urgent care and stat cares are open in the evening hours, and they try to fill that gap for patients who need services after hours. So it'll be nice to do that. And we try to maintain a relationship with your family provider, your family care provider, if they need our medical notes from your visit or your x-ray results or your lab results. It's very easy to have those things transferred over there as well.
Okay. All right. Well, that's very exciting for Alliance to have this new service. It's going to open, what, do you have an opening date?
I believe it's going to be the first week of February, if all goes well.
Okay.
So,
all
yes.
Right. A lot goes into that, I'm sure. You're going to be a very busy physician if you're not busy enough now. Was there anything else that we need to know about urgent care or about?
The only other thing that I like to mention also is that we, as urgent care, if you need stitches or if you have something that needs addressed, we certainly can do stitches. You don't need to go to the ER for your stitches. It's one of the nice services. We're kind of like a mini ER in some respects, that we can do some things that ER physicians do, again, without that longer wait time. And we often have people when they're leaving our office saying, I can't believe how fast that was to get in and out. I can't believe I ever went to the emergency room before and waited for that when we could just have it done here.
And especially with children,
Yes.
I mean, there's nothing worse than having a crying sick child and having to sit and sit and sit, and yeah,
Yes.
for something that could be easily treated at your
Mhm.
service. All right, well, I think that was all, except that what do you like most about your job?
My background's in family medicine.
Mhm.
I'm board certified in family medicine, so obviously I love that contact. And I feel like by being situated in Louisville, I kind of have like a home there that I know a lot of my families there. I've known them for years. I've taken care of babies that are now 7 years old, and I see them when they're sick, and I really love having that continuity of knowing my families in Louisville. So that's a great part of my job.
Okay. All right, well, thank you, Dr. Lavender, for being our guest today.
Thank you.
And thank you for watching Hospital Rounds. I'm Kyle Schwartz.